But I want to welcome everyone to this webinar this evening. It's a different format for me because I can't see everyone with the Zoom webinar. So I can't read faces or body language or facial expressions, but that's okay. I presume everyone can hear me all right, those in the back of the room. We'll start here in a second, but I just want to also thank everyone for taking the first step in your personal journey towards better health and wellness. So pat yourself on the back for that. Thank you for carving out some time in your evening during your busy work schedule or day schedule to join us and to learn more about some of the things I want to share with you all. Many of you probably have already had met me or already patients in my current practice, so you probably have come to learn that I'm somewhat quiet-natured, pensive, but I'm excited about some of the information I want to share with you this evening. So just again, recap, we'll have time at the end for questions and answers, so please use the chat function at the bottom there to enter your questions, and we'll get through them at the end. I have about 35 minutes, give or take, of slides and content to go through. Okay. So I want to confirm that everyone can see my slides okay with my technical team. Okay, very good. And we're off. So we're going to focus over the next 35 minutes on how to enjoy a gratifying quality of life. I'll make sure my slides are working. Give me 1 second. Here we go. And reconnect or perhaps maintain a connection with what is meaningful to each of us. We all share a common interest or the pursuit of enjoying hobbies and events and activities and regular connection with other people as a way to enjoy ourselves, enjoy those around us. And in fact, a lack of social connection, for example, is a risk factor for depressed mood, depressed outlook, and reduced longevity. Intrinsically, we all want to be happy and feel satisfied and content, enjoying what brings us pleasure while maintaining social connectedness. Here's obviously a slide with various examples of different activities that some of us might find enjoyable. And I got to tell you how I'm surprised at how popular pickleball has become. And it seems like all my patients are playing it regardless of their age. But it seems to be an enjoyable sport that's good for folks to get out in nature outside and be physically active. Sometimes on the beach, flying a kite with family is a way to enjoy ourselves. Eating among friends or with friends and family and being engaged in the preparation of the meal itself is another social activity that can be enjoyable. Spending time with our pets. Pets have been well recognized to release some of the feel-good neurotransmitters in the brain. So pets are important as well. And then just having protected quiet time for ourselves on a daily basis. And quiet time can take the form of meditation or some sort of biofeedback training or some form of blocking out the extrinsic world and just focusing on yourself to reconnect with yourself. But as human beings, we seek fun in sharing humor, stories, advice, and support with friends and family. We benefit from regular physical activity in nature, and we'll come back to the nature in a moment. I keep kind of underscoring that, but that's on purpose. But there's now science that has measured the positive impact of these factors on our health, well-being, and longevity. So at our core, we all want to enjoy a satisfying quality of life and maintain a connection with what is meaningful to us, and that can vary among us all. But in general, there are hobbies or things that we enjoy doing with other people that is a way to maintain our quality of life. But sometimes, or perhaps oftentimes, our quality of life is not what we would like for it to be. We're prevented perhaps from pursuing what is enjoyable to us, and this can be problematic for various reasons. But I can remember a few years back traveling to Italy to present at a conference, and my wife and I were able to peel off and visit the Amalfi Coast. And one of the little hotels we stumbled upon was this one here on a bright sunny day, and I was drawn to this sign hanging out in front of the front door. And I'll just blow it up so we all can see it. But it read both in Italian and English, "Time is your most precious gift." So time is, I would suggest, too precious to not pursue what is meaningful to you. Uh, and what factors or barriers that can arise that prevent us from pursuing a quality of life that we find enjoyable would include uh, just lack of energy, fatigue, brain fog, feeling unwell, or experiencing musculoskeletal aches or pains. And there are multiple internal and external factors that play a role in interfering with our ability to achieve our goals and aspirations. So, just for example, internal factors could include things like, on a physiologic level, if well, me, for example, the enzyme responsible for attaching what's called a methyl group onto folate, which is an element we get in our diet, which is important for cellular reactions. My enzyme doesn't work efficiently, so I have to take a supplement, a methylated folate supplement, to bypass or augment that step physiologically. But it's just an example of an internal factor, which alone is a little bit of a stress to our cells. But when other stressors are added to the picture, that one stressor mounts with other stressors, and then that can become an impediment to having energy levels that allow us to be active and vibrant and pursuing the activities we like. External factors could include toxicants in our environment. Uh, One example that comes to my mind is radon exposure in the home. It's interesting. I learned recently that Virginia more commonly has radon exposure levels in homes compared to the national average. Another example of an internal factor could be deficient vitamin D or B12 levels. If we're not getting enough sun, vitamin D might be suboptimal. If we've been on a acid suppress or gastric acid suppressant drug for a number of years, our B12 levels might be suboptimal because we weren't able to produce it in the gut and absorb it. But these are, again, different examples that, when they all come together or occur simultaneously, the stress to our system physiologically is compounded. And I would suggest that we shouldn't expect, or we shouldn't be prevented from enjoying a gratifying quality of life. And we'll come to understand how doing so is much more in our control. So, quick snapshot, so to speak, of kind of illustrating what appreciable quality of life is, and why it might be important, and some barriers to achieving a quality of life that we find enjoyable. But I bring this up because I've included myself in this group. I for a number of years, experienced a lot of the symptoms that some of you, or maybe many of you, have experienced, are experiencing, or have experienced in the past, or symptoms that someone you may know is experiencing, including brain fog or fatigue, reduced energy levels, feelings of anxiety or depressed mood or anger, worry about circumstances, worrying about the future, experiencing musculoskeletal aches, and contending with vitamin deficiencies or immune suppression, or just finding that every fall, winter, and spring you're contracting colds or illnesses or flu. These are just some examples from a long list of symptoms. And I was experiencing these for a number of years, uh, quite a long time, and just kind of pushed it to the side because as a physician, we were trained to just focus on our work and focus on our patients and focus on ourselves some other time whenever we have time to do so. But I was feeling cruddy like this, despite eating well and regular exercise and maintaining a healthy body weight. And I didn't smoke and didn't drink excessively, but yet these symptoms were constant. There were things I was contending with on a daily basis. But all that came to a head and culminated in 2020. Uh, Actually, backing up step, March of 2019, I lost my father to a neurodegenerative disorder, Lewy body disease. And then a year later, March of 2020, closed my practice for 2 months because of the pandemic, not knowing how we were going to get through that, because of course that was my only source of income. So I went through these two extreme stressors with a span of 12 months, and then coming back into the office after opening, after we had been closed, seeing patients wearing PPE. I hurt my back, and actually took a steroid taper, and my back started to feel better. But overall, I wasn't. I still felt cruddy, um, reduced fatigue, brain fog, just not a happy camper, despite being professionally productive. So it just wasn't making sense to me. And I started asking questions. I started reading and started tapping into resources through my colleagues. And initially, there weren't always answers, talking to my physician colleagues, because traditional medicine was having a hard time at times sorting this out. But I did eventually connect with a professional life coach who helped, and through regular communications with additional life coaches, I learned about an integrative medicine fellowship. In fact, Andrew Weil's integrative medicine fellowship through the University of Arizona, and I enrolled and just graduated recently from that program. I'll talk more about that in a second. But the point here is that I started asking questions, and my pursuit of the answers to these questions informed me how to take control over improving my quality of life and, in effect, reducing the risk for chronic disease. Because at that point, it was more clear to me what my family history was, and I was inherently concerned about how to avoid the onset of chronic disease. But in so doing, I was able to reconnect with what I identified was meaningful to me, and that is a quality of life that I find enjoyable, and just being present for those around me, because life is too short. Not everyone is going to be with us for an extended period of time. So, yeah, I mentioned the Integrative Medicine Fellowship Program, Andrew Weil's program. Here's some pictures of me with him at graduation. This was a fantastic training and educational program. Dr. Weil is the pioneer of the field of integrative health. Arguably, he's been practicing it for 50 years. The program itself had world-renowned faculty within it. It was a wonderful experience for me. I also became certified in heart rate variability biofeedback training. Heart rate variability is interesting. It's a measure of the variance in the heart rate from beat to beat, and it has been shown via research to be associated or correlates with overall health. And improving heart rate variability, which is possible, has a positive impact on various health biometrics, both physical and emotional and mental. So I need to also pause again for a moment to clarify that on these slides, you've seen this Connected Coherence MD. And what that is it's an integrative health practice that I just incorporated earlier this year, or actually last year, but it's now becoming more fully developed earlier this year. But it's a telehealth-based practice in which I work with clients to stepping them through a program to improve their quality of life, improve their overall health and wellness. So within that framework, I serve in the role or function the role of your guide or my client's guide to improving their quality of life and helping them reconnect with what's meaningful to them by applying what I've learned through my training and education in the past, actually 3 to 4 years now, but especially from what I've learned through Dr. Weil's Integrative Medicine Fellowship program. So next handful of slides, we'll take a look at what that sort of program, or what it would look like, to what we might focus on and how we might accomplish doing so, if our objective is to be healthier and more able-bodied and clear-minded, sharp-minded. So we just chronic stress we all hear about chronic stress and have an idea what that means, but it's fascinating, or was fascinating for me to understand at the cellular level and even at the gene expression level how stress has an impact. Just to give you a quick example, I mean, we probably have all heard of someone suffering stress-induced myocardial infarction, but the picture there would be someone who on face is a seemingly healthy individual, healthy body weight, typically physically active, workaholic though, maybe eats fairly well, but then in their mid to late 50s, they suffer a myocardial infarction, which is related to or chalked up to be due to stress. So how does that happen? Well, stress is a epigenetic influencer of gene expression. One of the many books I had a chance to read was one by Bruce Lipton, in which he talked about three epigenetic factors that play a role in gene expression: mechanical factors, inflammation, and then thoughts. Our thoughts actually do have an impact on gene expression and can, based on the positivity or negativity of the thoughts, can push us towards catabolic gene expression, which is more degradative, or anabolic gene expression, which is more regenerative and healing in nature. So the way we might accomplish these things would be to balance out the sympathetic and parasympathetic nervous systems. So our central nervous system is divided into the parasympathetic, which is responsible for promoting regeneration, rest, digestion, healing, and sympathetic, which is the system that helps us flee danger. And that's the fight or flight pathway, if you will, which is each are important, of course. If we want to get away from danger, we need our sympathetic nervous system to be fit and healthy. But by and large, we don't walk around with our sympathetic nervous system charged in overdrive, because then we're in a hyperarousal state. But actually, that's what happens with a lot of us on a daily basis, given all the things that come at us on a daily basis. So one step in the path towards an improved quality of life is to restore our sympathovagal balance, bring down the sympathetic tone, promote parasympathetic tone, so you have actually a parasympathetic dominance, and that improves our resilience and our ability to withstand injury and heal from injury by supporting cellular homeostasis, and that's key. And that's where the gene expression fits into that. But by supporting cellular homeostasis, we're promoting healing and also reducing inflammation. Inflammation is okay, healthy to a degree, but ongoing, unchecked inflammation is what is associated with chronic disease. And all of these steps, in addition to improving our quality of life, also help set the foundation for improved health span. Now, health span conceptually is the duration of our life in which we are active, able-bodied, sharp-minded, living a quality of life that we enjoy. Lifespan is just simply how long we live. So we might live 80 years, but the last 12 of those 80 years are just not the quality of life that's really enjoyable. And so the health span is what's a measure of the part of our life that's an enjoyable part, where we're able to be active. So how do we do this? Well, resolve stress, right? We all face stress. That's a fact of life, but we don't have to experience the stress. And a couple slides from now, I'll run a video in which Dr. Weil will share a breathing technique that's a good technique for helping handle stress. Sleep is when we heal. Sleep hygiene is important, and it's a surprise to me sometimes how common sleep hygiene is just not what it should be. We'll talk more about that in a second. Now, diet is medicine. What we eat is what will nourish our bodies. And the Mediterranean diet is one good example of an anti-inflammatory diet that's replete with antioxidants to help us deal with some of the stressors that we face on a daily basis, and to help us heal and allow us to have the energy levels that we want or need to be active. The creative arts, this is something, another area I learned a lot about during my fellowship training. And for example, one study conducted at Mayo over 4 years found that middle to older age adults who regularly engage in creative arts on a weekly basis had a 73% reduction in decline in cognitive function. Now, you don't have to be artistic or good at arts. You just have to engage in the arts. And the arts create more salient experiences, salient features being remarkable or striking, which trigger neuroplasticity, neural connections, and greater understanding. So when arts are incorporated into our lives, we strengthen our capacity to learn. And nature, tying back into nature again, nature is the quintessential art because there's so many different features of nature that tap into all of our senses. Exercise, we all know exercise is healthy. It can be a challenge to engage in regular physical activity for different reasons, but just to point out a few things here. If a lower limb condition, maybe an arthritic knee, prevents someone from getting on the treadmill, well, sitting down and doing upper body exercises can be just as beneficial. That can help raise the heart rate, improve oxygen and gaseous exchange, and have a positive impact overall. Standing, using a standing desk. Standing burns more calories than sitting. So if we can stand during the workday doing work rather than sitting, that's a positive impact as well. Quick note there that sitting greater than 6 hours a day consistently is associated with a 40% increase in mortality over the ensuing 10 years. So sitting is like the new smoking. And then lastly, efficient detoxification. Uh, Organic foods is a good example here. Organic produce, especially foods that are produced without pesticides and herbicides to minimize man-made chemicals that we come in contact with, is very important. If we have access to a water detoxification system, that's also important to clean our water that we drink. So, I think the slide I need, this one, here we go. All right. So I'm going to trust that this is going to work.
The 4-7-8 breath that I teach is the most powerful relaxation.
Okay. I want to make sure it worked. This is Andrew Weil, and he's going to talk about his the 4-7-8 breath technique. But just to know real quick, you're going to, the concept here is to breathe in through your nose to the count of 4, hold over the count of 7, and then exhale through your mouth over the count of 8. And he's going to explain that technique and demonstrate it and talk about it in a little more detail here.
Method that I've discovered. It's very simple, requires no equipment, takes very little time, costs nothing. And it is a practice. It's something that you have to do regularly. So in this technique, you breathe in through your nose quietly to a count of 4, hold your breath for a count of 7, and then blow air out through your mouth audibly and forcefully. And you do this for a total of 4 breath cycles. So I'm going to show you what this looks like. And that's all. It's a bit hard for me to come back and talk to you after I do that because this produces a very pleasant altered state of consciousness that I'd rather stay in. You may not get that the first time you try it, but it's a reward of practicing this. And this is a practice. You must do this at least twice a day. So that 4 breath cycles at least twice a day. After a month, if you're comfortable with it, you can increase to 8 breath cycles each time you do it, but that's the absolute maximum. You can do it more frequently than twice a day, but never more than 4 8 breath cycles at one time. It may take 4 to 6 weeks before you notice physiological changes from this. But over time, practicing this will lower heart rate, lower blood pressure, improve digestion, improve circulation. It promotes sleep if you get up in the middle of the night for any reason. It is the most effective anti-anxiety technique that I've found. I've taught it to patients with the most extreme forms of panic disorder who eventually brought that under control just relying on this breathing technique. So please practice it, do it regularly, and I think you'll be very pleased with the results.
Okay. So I first learned about this technique from Dr. Weil. I did it myself, and I would recommend doing it twice a day if you do pick it up, but in the morning and the evening, not too late in the evening because you don't want to be too tired and beat from the day. But Dr. Weil is a fascinating individual. He's about 80 years old, and he's been practicing integrative medicine for 50 years. Traveled the world and just has a tremendous perspective and viewpoint. He's still very active, and it was a wonderful opportunity to tap into his expertise during the fellowship here. So the technique I would encourage you to start to incorporate. I did it for a while, and then actually found out like meditation as well. And then after the meditation, I started doing some other things, but try play around with it and see if you like it and incorporate it into your daily personal time, because it can be quite helpful, quite beneficial. So that's a technique that can be used to help mitigate or manage stress, just as Dr. Weil suggested, and even also to help fall back to sleep if you have trouble sleeping. Sleeping, by the way, sleep hygiene is important. As I said, that's when we heal. Um, Try to wake up the same time every morning, regardless of what time you went to bed the night before, and no blue light 90 minutes, ideally 90 minutes, not more within 90 minutes of bedtime. Blue light is stimulating, so light from computer screens, iPhones, phones in general, TVs, um, can alert you and make it harder to fall asleep. Read a book over that time period rather than put yourself in front of blue light. Now, diet. I'm going to spend a minute here because this is data from a large study, which it seems maybe logical, but it was quite fascinating to look at these results. Now, this was a large trial called the Predimed study, but this was a study of nearly 7,500 subjects who underwent median follow-up of 4.8 years, so almost 5-year duration. These folks were followed over time. Now, these individuals ate a Mediterranean diet, and we'll talk about what makes up a Mediterranean diet here in a moment, but they ate a Mediterranean diet that was supplemented with either extra virgin olive oil or nuts, and they were followed over time for risk reduction in various chronic conditions. So the bottom of this slide here is percent reduction in risk. So moving towards the right is a positive reduction in risk. So 10, 20, 30, 40, 50, 60% reduction in risk. And on the vertical axis are different chronic conditions ranging from breast cancer, diabetes, cardiovascular disease. And you can see, so the blue are the folks who had the Mediterranean diet and extra virgin olive oil, and the green, we'll call it green. The green bars are folks who had ate Mediterranean diet supplemented with nuts. And you can see over the vast majority of these conditions, a 10, 20, 30, up to 60% reduction in various conditions. For example, breast cancer reduction up to 60%, upwards of 60%. Peripheral artery disease, again, 60, 65% reduction. Cardiovascular disease, 30% reduction over this time period. That's quite remarkable just by adjusting your diet, something we do on a daily basis, of course. It's key that this diet or a healthy diet does not contain processed foods or contains minimal processed foods. Now, admittedly, olive oil is a processed food, right? I mean, the oil is harvested from the olives, but it's not ultra processed like the Twinkie or the chips that we might snack on occasion. No sugar, including fruit juices. Little known fact is that when a fruit is juiced and we drink the juice from the fruit, the fiber of the fruit is removed, but the fructose from the fruit remains. And the fructose still can stimulate insulin release and drive glucose levels upward, whereas the fiber in the fruit helps mitigate against that. So if you want fruit juice, just consume the whole fruit as a whole. Let me bring up here's our slide on the Mediterranean diet, just to give an idea. I mean, if we were live, I would say, show me, everyone raise your hand who's heard of the Mediterranean diet or diet pattern. We've all heard about it. But if we were to write out what a meal like look like that's compliant with the Mediterranean diet, that might be a little more challenging. But here we are, and it's a diet that's replete with multicolored fruits and vegetables, whole grains, meaning grains that you can actually see that aren't ground up, beans, nuts, legumes, olive oil, seeds, herbs, spices. And so if you were to imagine your plate, over half of the plate would be comprised of all these sorts of things, all these sorts of foods, fruit and produce. And then a smaller amount will be fish and seafood a couple times a week, especially fish that's higher in omega-3 content, such as salmon, and then cheese, poultry on occasion, and then rarely sweets and red meats, and then wine on occasion, and lots of water, and enjoy the meal with a group of people. Eat among company, and then be active in between meals. Those are the key takeaways of a Mediterranean diet pattern. And so one might ask, doing all these things, is there evidence to show that there's a positive health impact, or what evidence is there? And yeah, it is a challenge. The PREDIMED study that studied the impact of the Mediterranean diet, that's a challenge to conduct that sort of study, because how do you control strictly for an intervention of diet or diet change? Well, if we look even on during contemporary times across the world, there are areas that in which people live to be healthy and active well into their 80s, 90s, and over 100 years old. These areas have been referred to as the blue zones. There's 5 of them, and they are referred to as the blue zones because initially, when they were found, they were circled on a map with a blue felt tip pen, and they were referred to as the blue zones. But when these blue zones have been studied and the characteristics of the folks living in these blue zones has been studied, there's some common themes or features that emerge. But real quickly, these are the 5 here: Okinawa, Japan; Icaria, Greece; Sardinia, Italy; the Nicoya Peninsula, Costa Rica; and then Loma Linda, California. But these are the 5 areas in the world where the highest proportion of people live well past 100 and live healthy lifestyles, which is remarkable. The oldest human on record was a French woman who lived to be 122 years old. So there's reason to believe that any of us could live to be 100 or 120 even, and still be healthy 100 or 110 or 115 years old. So when we look at these 5 blue zones, there's 9 common features or themes that become apparent. And Dan Buettner is the journalist and the author who's spent the bulk of his adult career studying these blue zones. So number one, they move naturally. They move naturally in nature. So they're out in their gardens, tending to their gardens on a daily basis. The Sardinians, for example, tend to their sheep, their herds of sheep. So being out in nature, as we mentioned earlier, has a positive health impact, and moving naturally, not necessarily being in a gym lifting weights, but being active, going through full range of motion, doing normal activities. These folks didn't fill up when they ate. They had what's referred to as an 80% rule, or the Japanese or the Okinawans would say hari hakabu at the beginning of their meal, which means eat until you have consumed 80% of what's on your plate. You leave 20% behind. So they didn't overeat. It's a form of calorie restriction, which is an anti-aging effect. They ate whole food, plant-based diets. Not a lot of meat. Meat was reserved for special occasions. Now, all but one of the blue zones consume alcohol. The Seventh-day Adventists in Loma Linda, California do not, but the other 4 do. In fact, the Sardinians enjoy their red wine well before happy hour sometimes. But interestingly, their red wine that's produced on that island, Sardinia, is high in phytochemicals, which contain antioxidants. So there's an added boost there. These folks have a sense of purpose. They have a why. They have a reason for why they get up in the morning, and that helps instill a form of hope. It has a positive impact on health span. They, on a daily basis, they would downshift, or another way to refer to having personal quiet time, whether meditation or some form of spirituality or connection. So that's important as well. They had a sense of belonging and a social structure, whether it was a church or parish or some other social group within their community, and they had regular connection with folks in that community. So social connectedness is very important. Loved ones first. The extended family was close by. Sometimes the elders were living in the same house or the next house over to their sons, daughters, and grandkids. Uh, that's interesting to think about because the wisdom of the elders was able to be passed down to among generations. So that's important as well. And right tribe is a reference to how folks congregated, so to speak, and they shared the same hobbies or the same lifestyle habits, which is important. There is research showing that you will adopt the habits of those individuals that you spend time with, that you congregate with, or that you hang out with. So if you hang out with folks who have healthy lifestyle habits, then you're going to start to assimilate those habits yourself. So these are the 9 themes that have emerged as common elements from all the world's 5 blue zones. So that would serve as, I would suggest, some fairly robust evidence for supporting various lifestyle modifications and integrative health interventions that would promote a healthy lifestyle and improve your quality of life. And so how would we define a enjoyable quality of life or the successful reconnection with what's meaningful to us and the improvement in our quality of life? Well, when we get to that point, there's a feeling of improved well-being, feeling less overwhelmed, which translates into greater resilience. I can tell you now, sitting here today, compared to a few years ago, I don't sweat the things that come up out of left field, the fires that come up, or the things that used to make me say WTF. I mean, now I might say WTF, but it's a joke, or it's an expression of humor. I mean, I don't let the stressors get to me the way I used to. So I don't feel overwhelmed at all like I used to. And sorry, my light went out, so I'm gonna wave my hand to turn it back on. I attribute that to an improvement in my sympathovagal balance, which I worked hard to do using different interventions and therapies, and my quality of life is much better now. And I know that I've stepped towards improved health span and reduce my risk for developing chronic diseases. Now, folks who have that reached this point that have reconnected with what's meaningful to them, they enjoy active lifestyles. And just to illustrate this real quickly, kind of in starting to close here, the young dad in the upper left who's enjoying time with his daughter on the skateboard reminds me of when my son wanted to build a pond in the backyard. And I don't mean a big pond, it was just a 3x2 plastic insert. We had to dig out the earth to do it. This was handful of years ago, back when I was in the middle of burnout and just feeling crummy, and my energy was not what it should have been, and I just, if that was something an activity that I did now, I know would have been much more enjoyable for me than it was back then. Probably for him too, I would imagine. But anyway, just enjoying time with your kids, because they're going to grow up so quickly. And on the right, you see the young family just being present in the moment, enjoying each other's company, not worrying about tomorrow or the future, and not second questioning or guessing their actions or decisions they made earlier in the day or the day before. And then practicing daily meditation or quiet time is important to help maintain quality of life. And then being active well into our golden years with our peers out in nature. Tai Chi is what's being illustrated in the middle bottom. And Tai Chi is a wonderful exercise for balance, fall reduction training. Falls is the #1 reason for accidental death in older adults. So it's important to maintain stability as we age. And then, of course, cooking. Just final comment on this lower right-hand picture. Of course, we talked about the health impact of a good diet, but what's wonderful about this slide, about this picture, is that the young couple, they're eating well, but look what they're also doing. they're also modeling healthy behavior for their two young children. And I think that's also key that as you adopt healthy lifestyle habits, those around you, as we said, your tribe will adopt those habits too. And of course, we want to help our kids take the best step forward. And now, by doing nothing, if we allow our thoughts to remain negative and come up with reasons or perhaps excuses for not doing something about it, our quality of life will never improve, and we wouldn't be able to reconnect with what's meaningful to us. And I would suggest that that's problematic because, as we pointed out earlier, time is your most precious gift. So please don't waste it by not optimizing your quality of life. Uh, for what it's worth, I wish I'd gone through this process several years ago. I mean, the events I described in 2019 and 2020 were actually a gift when I look back on things, because it going through that forced me to focus on my health and take it seriously, and then reach out to others for help. And now I am here in a much better spot, and putting myself in a position to help my patients and clients to get back to a similar place where they have a more enjoyable quality of life. So as I mentioned, Connected Coherence MD, it's a telehealth practice I established. We have a 6-month program that focuses on improving your quality of life and helping clients reconnect with what's meaningful to them. And the website is right here, and these slides will be available later. But connectedcoherencemd.com is the website. You would find on the website, start your program button, pretty well bulleted out, and click on that. And then you can move forward to scheduling appointments through our electronic medical record platform. And that's how you would get started. And the 6-month program, what it looks like, it's a 6-month program comprised of 15 one-on-one telehealth sessions with me. So you'd have my undivided attention. We would take in-depth assessment of you and where you are, and we would focus on regenerative efforts and utilize research-backed strategies. The program does include 3 therapeutic devices that are geared towards improving that sympathovagal balance that we talked about. And we also would craft a plan that would include personalized recommendations for supplements, botanicals, vitamins that we discover are suboptimal or need to be supported in you, as well as a diet plan, exercise plan, and talk about steps for detoxification, things we can implement on a daily basis to help do so. So time is your most precious gift, and now is the time to optimize your quality of life. This is a 6-month program we are offering during our founders cohort, and your investment in the 6-month program is listed here, 12,397. But that would represent your investment into the 6 months and provide those your access. You would actually get those devices I mentioned that would become yours to use for the 6 months as well as beyond the 6 months. And my second to last closing slide. I was encouraged to include pictures of myself and my family, which I think is a nice touch. But me and my family here, and my son loves to fish. So that's me on the beach in the lower left. I don't know what we're looking at the end of that fishing pole, but there's no fish there. And my daughter in the lower right-hand corner was just trying to have as much fun as my son was. But again, pictures of enjoying a quality of life that we define for ourselves helps bring us enjoyment. I just want to thank 4 individuals whose effort and intelligence and experience it was integral in putting on this webinar this evening. But on the left is Sirishan Khalsa, who actually built my website and developed it and has provided input and expertise and direction for my practice. She's an integrative medicine and lifestyle medicine expert and a faculty member in Dr. Wild's fellowship program. And then next to her is my wife, who is a retired pediatrician and a certified life coach. um, whose support is immeasurable. And she is giving me various inputs and advice and guidance in support of the webinar tonight, as well as the whole practice and everything else I pursue. And next to her is Vicki Morales, my director of operations, who has been very patient with me, but she put together the Zoom webinar and helped send out the emails and get the EMR platform established and help upload forms that you guys will fill out when you register. So a big thank you to Vicki as well. And then lastly, on the far right is my daughter, who, despite the rigors of being a third-year architecture student, has helped me whenever I've asked, putting together the forms, creating editable PDFs, which you guys will fill out when you register. But she's helped with the slides as well, and just in general has never hesitated to help when I've asked. So anyway, thank you to those four young ladies. But I'm well over 35 minutes. I'm not sure what gave me an idea. I only need 35 minutes to get through these slides, but I have gotten through them. And so now we have time for questions. And
Hey, Dr. De Palma, it's Vicky. So we do have some questions that came in.
Okay, good.
All right, one said from Eve, it says, thanks, Dr. De Palma, for this insightful initiative. How does one know that they have chronic inflammation if there are no symptoms?
Wow. That's a good question. And symptoms can vary. Maybe it's quite possible that someone doesn't have inflammation, that, if we were to look at someone from Sardinia, Italy, they might have minimal inflammation because they're well balanced. So there's a couple different ways to look at this. One is we could look at lab markers to see if there's subtle markers of suggestive of inflammation. The other one would just be taking a close history and teasing out any fluctuation in symptoms, and symptoms can vary. I mean, fatigue or how they sleep. Looking at vitamin levels in the blood, for example, vitamin D is suboptimal. That could be an indication that there's imbalance, partly because of unchecked inflammation. Sugar control. If someone's hemoglobin A1C is slightly elevated, but still not diabetic, still pre-diabetic, that could be an indication that inflammation is present. Similarly, B12 could be suboptimal because we're not able to absorb it well in the gut. Gut health as well, which is a broad topic, can also be a measure of whether inflammation is present. So it's a long-winded answer, and it's not a straightforward answer. There's several different ways to assess that. It's a good question, though. Thank you.
Awesome, thanks. Another question that came in is, how do I get started if I want to move on to the next step?
Well, connectedcoherencemd.com is the website. And on there's two next steps. One would be start your program button, click on that, schedule your first of your 15 one-on-one visits. There is also an option for an introductory call, which would be a 45-minute call. And the fee for that would get rolled over towards the program fee if you enroll in the program within 72 hours after that introductory call. So there's two buttons on the website, the start your program button or schedule introductory call button.
All right, the next one is from Barbara. If I enroll in Connected Coherence MD's program, how long will it take before I notice improvement?
Yeah, it's a good question, and it will vary from client to client. I'll share with you my experience would be within 4 to 6 weeks. Initially, we work on heart rate variability using heart rate variability biofeedback device. And within 4 to 6 weeks, one can notice a calming effect. And then from there, it would expand. I mean, notice an increase in energy levels, sleeping better, fewer aches and pains. So within 4 to 6 weeks.
Awesome. Another question that came in from John, does the program include supplements or vitamins or botanicals?
Yes, that's part of the personalized diet and supplement botanical component, where I'll design with the client or identify what their needs may be if we determine the vitamin D is suboptimal. I say suboptimal because it might be normal as indicated on the lab sheet, on the lab report. For example, vitamin D, a lot of labs will include a level of 35 as a lower end of normal. Well, the optimal range is above 55. So you might have a level of 38 or 40, 42, and the lab would say that's within normal limits, but that's not optimal. Optimal would be greater than 55. So I would advise clients of this, and then we would talk about the formulation. Like if someone's a vegetarian or a vegan, there's certain vitamin D supplements we would have to stay away from because they're not solely the supplement may contain something derived from an animal product. So I would help guide patients through that process. The program does not provide, the patient would still have to purchase the supplements, but there is a discount through the program that the clients can take advantage of.
Great. Mark asked, what's the difference between Connected Coherence and Virginia Eye Spine Physicians?
Good question, and I'm glad that was asked. Just to clarify, so Virginia Eye Spine Physicians is my current practice where probably a lot of our viewers this evening know me from. Whereas Connected Coherence MD is a new telehealth-based practice, so it's one-on-one via telehealth format in which we guide clients through our program to improve their quality of life. So there's different focus for each practice. Connected Coherence MD, our initial program is how to improve your quality of life, and then I'm working on a subsequent program which might focus on health span, but there's going to be some neat things there as well. But the 6-month program that we're offering immediately right now, I'm excited about because I've gone through the program where I've put the program together, incorporating things I've learned over the past probably upwards of 4 years and tapping into various experts. One example would be Dr. Weil. So I'm really excited about having the opportunity to help folks or help guide folks through that. So anyway, the difference, the Connected Coherence MD is a telehealth integrated medicine, lifestyle medicine practice, which is not through insurance, by the way. It's not covered by insurance or Medicare. So it's direct one-on-one with the client. So we are not held or restricted by any third-party payer coverage policies. And a lot of these things aren't covered because I don't want to say they're non-traditional, but they are integrated medicine, lifestyle medicine-based therapies.
Thanks. We're going to end up on this last one from Elizabeth. She said, wow, I'm gratified to see you and your practice headed in this direction. I'm already doing a lot of what you mentioned, so I don't think it makes sense to do a full 6-month course. However, I'd love to know your thoughts on how I can enhance the work I'm doing. Are you offering an abbreviated option for folks already on this path?
So thank you, Elizabeth, for the question. Part of throwing this out there is getting feedback on what people want or need. And so the immediate answer is not yet. But I'm constantly kicking ideas around for how to disseminate information on a regular basis. So I have ideas for a podcast eventually, which would be thematic, where we'd have guests in and we'd have maybe a podcast or two on certain topics. That's not here yet. In terms of abbreviated course, I don't have the 6-month course I put together. I found that the things that we go through and that we're going to step through are integral or valuable or important. So I don't want to cut any of them out. So so I don't know yet in terms of an abbreviated course, but I do anticipate down the road having other ways for people to get access to all this information. It's a good question. Thank you.
Dr. DePalma, if people have additional questions, where should they contact you at?
So on the website, there's a contact submission form under the contact subpage, and the little form you enter your name, your email, and your message or feedback, and that will eventually make its way to me, and then I'll be able to respond that way.
Great. Well, we have more, but we want to wrap it up for the end of the day.
Yeah, we're coming up on an hour, so okay, good. So we got through most of them. Okay. Well, thank you, everybody. I trust this was helpful, and if there were more questions than what got asked through the chat function, feel free to put them in that box on the website, or schedule an initial introductory call, or if you're ready to jump right in, start your program. But thank you, Vicki. That's it. Well, I guess we'll sign off for the evening.